A holiday surge in COVID cases adding to a strain on local hospitals, even as a new variant threatens to trigger new outbreaks. Here to answer your questions is Dr. Helen Boucher, the interim dean of Tufts Medical School and an infectious disease specialist at Tufts Medical Center. Dr. Boucher, good to see you.
Great to see you.
So I'm sure you're exhausted by this. We're exhausted by this. I think everybody thought by now it would be over or nearly over, but the director of the National Institutes of Health said today that the U.S. is not in a good place right now. Over 100,000 new cases every day. So where are the hot spots? I would have to think one of them is here because our case numbers have skyrocketed, but what's your assessment of how Massachusetts compares?
Well, Ben, it certainly is disappointing to see the cases rise as they have. And indeed, the North is a relative hotspot. And here in Massachusetts, we are at a higher case rate than we would like, and the hospitals are starting to feel it. I think that it's important to note that we're in a different place than we were last year, despite these numbers, and we still have very good tools in the toolbox, especially vaccination, to help protect us and allow us to keep on living our lives.
Well, Dr. Boucher, state data shows many hospitals, as we mentioned, they're near capacity right now. So how's Tufts doing?
Well, we are feeling the pain as everybody is. We're 115% capacity today, and we're really feeling this largely due to non-COVID patients. In fact, we have a number of patients who are very acutely ill with illnesses that are the consequence of delaying care during the earlier phases of COVID. So add to that this uptick that we've seen, and it's putting us in a tough spot with all the other hospitals across the state and the workforce issues that we're all experiencing. So we really need people to get vaccinated, follow those mitigation measures so we don't see a further uptick here.
I want to ask you some of the questions we are getting from viewers. Robin writes this, quote, I see the daily number of COVID cases. Does that number include positive results from at-home tests? I don't know the answer to this one, does it?
Well, it can, and if that at-home test is reported, it would be included. I think it's very important to note that it doesn't include the denominator of how many at-home tests are done. And so there are a number of factors that make interpreting case numbers difficult. So having the presence of at-home tests is just one of them. So we know what we know what's reported, and it doesn't look good. I think that's the message for people today.
Well, here's another question. This one comes from Beth. She wants to know, what does it mean if your PCR test is flagged as abnormal?
Yeah, sometimes you can get a result like this because something is off with the test. It's not clearly negative or positive. And so in that case, often the test needs to be repeated. It doesn't happen often, but these are very sophisticated tests. And in that case, you will receive instructions about what to do next. And as I mentioned, it's often repeat the test.
All right, Dr. Helen Boucher, interim dean at Tufts Medical School. Thanks so much for your time as always.
Thank you.
Yeah.